Okay, thank you, Kelly, for the warm welcome. And just to say, I'm here with my colleague Brayne to present this study that we did together. I work at the University of Worcester, and we do train nursing students there. So we wanted to test this with our student nurses. So what we'll do in this next 35 or so minutes is to talk about what death cafes are and how they started and how they've been used in this country. And then we will lead on to that into the actual study that we did, and then share with you what we found and what that actually means for nurse education and also for training and opening up discussions around death and dying. So my colleague Sue will start us off. Let me just share our slides, and then obviously Sue will give her full introduction because I wouldn't be able to do her justice really. So she'll give a full introduction herself. So here is our first slide, and over to you, Sue.
Okay, can everybody, and Kelly, can everybody see me okay? Yeah?
Yeah, what I can see basically the presentation is the main screen, and you're smaller in the corner.
Fantastic.
So a bit of both.
Okay. Yeah, and welcome to everybody. This is so wonderful to see everybody coming in, to be so interested about how the death cafes were received by these third year students. So welcome everyone. My name is Sue Brayne. I was the Death Cafe facilitator, which was such a wonderful experience for me because we actually ran them back to back. So I'd never done 3 or 4 death cafes like this, although they were moderated death cafes, to be fair. But for those who don't know me, I've been working with end of life and death and dying for the last 25 years. And my mission is to help people to talk more honestly and openly about end of life and death and dying. I have an MA in the rhetoric and rituals of death, and I met Brian through Teresa Mitchell, who I can't remember where I met her, but we started talking about death cafes, and they invited me to come and facilitate these death cafes. So we'll just I'll start by introducing the actual what death cafes are. I must have run, oh gosh, way over 100 now in all sorts of different settings, but this was the first ones that I actually ran in a university setting, so it was great. Please forgive the fact the wordings come off the end of the screen, but I'll just run through what exactly the background of the death cafes are. And the person that you're seeing the picture of is the wonderful John Underwood, who set up the whole death cafe movement. So basically his vision was to enable us all to talk about death and dying in a much broader, much safer way. And his vision was to sort of for them to be safe, confidential spaces for anyone from any walk of life to come and talk about death and dying in any way they want to, over the obligatory cup of tea and piece of cake. Sadly, we didn't get the piece of cake actually at the university, but we did get the tea. So as I said, John set up the movement in 2011, and he set up this website called www.deathcafe.com. And if you want to find more information about the whole Death Cafe movement, please do look up there. John himself was a Buddhist, and he was inspired by the work of Bernie Kretz, who was a Swiss psychologist who held the first Café Morels in Switzerland, sort of like way back in the early 2000s. And he just wanted to, John was really interested in how Bernard was holding these death cafes in these cafes and how they were being so well received. So he was very inspired by that. So he came back to England, and he and his mum, and she's a psychotherapist, they held the first death cafe in his mum Sue's house in 2011. That was the first one that he and she did together. And since then, literally thousands and thousands of death cafes have been held all throughout the whole world. And normally they're held in either people's homes or in cafe settings, but these days they're also held on Zoom, which actually makes them far more accessibly internationally. So I've held quite large death cafes on Zoom, you know, with people from all over the world, from Thailand to Australia to America. So I'm finding it really exciting that we can now hold these death cafes on Zoom. So the concept of the death cafes, really, John was really clear this. They're absolutely not-for-profit basis. They're certainly not a place to sell products or promote any businesses. They're not a place to preach, teach, or lead conversations. Rather, they're a space to take off the personal and professional masks and label and speak from the heart about our relationship with death and dying. That's what they are for. So they're not a teaching aid. They're about really communicating together about end of life and death and dying from our own personal perspective. And Death Cafe facilitators, and I speak as one myself, are passionate about providing a space to talk about death and dying. And that's basically the concept. But again, if you want to find further information about this, just go to www.deathcafe.com. Okay, so I'm now going to pass over to Brian to take over and explain to you what happened as we created these death cafes for the third year nursing students. So Brian, do you want to take over?
Yes, thank you very much, Sue, for that. And what we realized was that these death cafes are being used for the public, and they hadn't been used for discussing death and dying with nursing students. So we wanted to create a modified version of death cafes, and Sue was very instrumental in helping us on creating that modified version. And of course, the absence of the cake was, in our view, modified version of the death cafe. And we wanted really to test two things here: the students' experience of attending a death cafe, and also to look at what sense they made of it. What was the impact of having a death cafe as a medium, as a vehicle to learn about death and dying? So it's a facilitated medium for the students to come together and learn about that. So for those of you who are interested in research and how methodology is used, we used a qualitative design where we were talking to individual students after they had attended the death cafe sessions. We then invited them to an interview to take part in the study, and we interviewed them face to face. Obviously, we used semi-structured interviews, so that means we have an idea of what questions we want to ask, but we were very flexible in the way we asked those questions, depending on the answers the students were giving us. So we would just follow that and just and probe a bit further. So it wasn't as structured or as fixed as that. In terms of the type of sample we used, we used what we call a purposive sample. In other words, we selected the people who fit our criteria, and these were third-year nursing students who had attended a death cafe, modified death cafe session. And that's how we selected them. And then the data we got from the interviews, we were looking for any common things that were coming through from what they told us. So hence we did thematic analysis of the data. We also had ethics approval from the university to do this study. And I think this was important if we wanted to publish our findings later, which I'll talk about, later on. And in terms of sample size here, we presented the death cafes to about 50 students who came to attend, and then we, at the end, managed to have a sample of 5 that we actually interviewed. And again, I'll explain why that was the case. So after the interviews, then what did we find? And just before I touch on that, there were three people who interviewed the students. We had set out to interview five each. So Teresa, myself, and Mary Bruce, who again can be with us today. So we set ourselves to interview five each, but obviously we ended up interviewing less than that. So what did we find from the students? Um, so overall, the students found the modified death cafes to be a positive experience to them. They found it to be less threatening as an experience to actually learn and talk about death and dying. And from what they told us, we came up with five themes that we developed from that. And first one was anticipation of death cafes because they talked quite a lot about that. The timing of death cafes, and then the facilitation itself, which we thought was really, really interesting, and then the trust within the group of students themselves, and the reflections they made at the end of it for themselves and for practice as well. So what I will do now is to go through those five themes individually, and just what we've done. Obviously, we couldn't include all the quotes, but we've just selected some quotes for this presentation so that it gives you a flavor of what was said to us. So the theme of anticipation of death cafes, I don't know how clear this is, it's gone very small on my screen now. Students told us that they were apprehensive about death cafe, and they use words such as a bit scary, confused, sounded a bit gloomy, but having said all that, they actually stayed until the end of the session that they attended. And one participant summed it all up for us when they said that there was no one stood there pushing people in. We were definitely given the opportunity not to participate. And once you were in the group, if you wanted to leave, you could. So again, the voluntary nature, if you like, of research, that's what happened there. Now, there was also another comment to do with the timing itself of the Death Cafe sessions. Participant 5, it said, it would have been a really valuable thing to have this at the start of our training. And of course, as I said, we were doing this in their third year. So they felt that they would have benefited if it was in the first year of their training, suggesting that having a death cafe earlier in the course would have benefited their practice because anxieties would have been allayed. And then they also said, one participant once said, I wish I had it in the first year, and then again maybe third year, or a little bit earlier, because I got rid of so many anxieties around it. I think if I'd had it sooner, I would have gone into practice a little less scared. The same participant also said, my first death, I had a panic attack after it, and I was off the ward for a good hour. I was crying on the phone to my mum. Honest to God, I was petrified. So again, they just related their experience there and saying that maybe if they'd had the death cafe earlier, that might have actually helped with the way they reacted when they got into practice. And the other theme was about facilitation of the death cafes themselves, because we brought in Sue, who is an external person from the university, and we actually wanted that she was also accredited, qualified, experienced, rather than ask any of the lecturers like myself within the university to facilitate that. So this is what they were commenting on. Students' comments below articulated the advantages of having an external person not known to them to facilitate death cafes, and suggested students could be more honest and impartial. And participant 1 said, you haven't got a judgment on that person, someone you've never met, who comes across as really nice. That's Sue, she's very nice. Makes you feel relaxed. Yeah. And then participant 2 felt that the process could have been affected if a non-lecturer was present. And this is what they said. It might have changed how honest people could be. If you think if you think, oh, that's my personal tutor, because then that's the person they would be working with throughout their training. So, and again, it just told us how important the external facilitation was. The last one here was participant 4, who said it it was run by one of our if it was run by one of our teaching team, you might necessarily say what you would want to say. So there would have been some holding back there. I think that's what we're getting from what these participants were telling us. And if we then move on to the next theme, which was about trust within the group itself. So these are students who've been together for the last 3 years. Yeah. So participants reported that Death Cafe environment had allowed them to connect with each other just as people who had experiences rather than as students who talk in class. And we thought that was really, really telling in terms of how participant 2 articulated that they were now seeing each other as people, not as students. It engaged every single person. I've not known a taught session do that in the whole 3 years. So again, I think it's down to Sue's facilitation skills here, how much engagement there was. And then we heard this from participant 1, 3, and 5, that it was the most valuable 1.5 hours I've had out of the whole 3 years. And participant 3 said, I think it was just such an unexpectedly good experience and important. It's one of those moments that I'll really, really take away from my course. I think I'll always remember it. And then participant 5 said, it's good to hear other people's experiences, compare them to yours, and talk about things you might improve. So again, we sense that there was a collective coming together, discussing what would otherwise be such a difficult, sensitive topic, but they found that quite helpful the way we did it. And in terms of reflections, which was the final theme we came up with, the process had provided a safe space for reflection, as noted by participant 2. It has probably been the first thing I have been able to do in a long time that has meant that I have looked at myself. Yeah. And then the others, participant 1 here noted that it was really shocking to me. My friends and I were talking about it afterwards, and we were really surprised how all of us, even those with healthcare experience and things like that, how we had all improved. So it was very useful. It's helped with my overall thoughts and resilience and things. And I learned that everyone's experience is different. And I maybe feel better prepared for having the experience of talking about it, recognizing that it is the normal thing to do in practice, and that was from participant 5. So again, quite positive comments that were coming there, showing how much they had learned from these experiences. So we obviously, having done this, we thought that the way the students responded and explained to us was quite positive. Yes, we realized that there was some apprehension at the beginning about what would be expected of students within the Death Cafe session. Having some warning or preparation about potentially emotional nature of the session was recommended. So again, I think this is something for future where it needs to be explained well in advance and clearly what is expected within a Death Cafe. And also for them to have a break after Death Cafe session so they could gather their thoughts and have time for reflection before the next session. So what happened with the Death Cafes is that when they finished, students didn't have any space in between. They were taken straight to the next session, which we had no control over because that's how it was timetabled. But I think what we learned from that is they needed that gap, that break, just to gather their thoughts again. The possibility of meeting up informally to talk about death and dying and the value of discussing this in a death cafe brought about collective security through support for each other. And we thought that was really, really important to emphasize this collective security that people have when you're talking about sensitive topics. So again, we are quite upbeat about the study itself and what it produced. So the in terms of our conclusions, obviously you can read more detail in the paper, but students voiced their preference to disclose their feelings to an expert facilitator because they thought they might be judged by their own nursing lecturers. Now, this is an interesting one for universities like ours, because by getting somebody from outside, it means they have to pay uh, an extra, consultation fee for them. So they would probably be resisting that and wanting the lecturers like myself to do the facilitation. But I don't think we all have the skills good enough, like Sue, to do that. So we think facilitation is critical to the self-scrutiny and disclosure by students, because it's done in a safe way by somebody with the expertise to do it. It becomes more less threatening. And the modified death cafe session achieved this. So we're very much in favor of using expert external facilitation. Death cafe environment provided safety and security to allow learning about death and disclosure of students' perceptions and their concerns. In terms of the um, implication for nursing education, it is expected that students may feel vulnerable in a death cafe, but it is important that this vulnerability can be translated into strength, enabling openness and reciprocal sharing of inner thoughts and feelings about death and dying. And I think this is what we did through the facilitation skills of Sue, to actually translate that vulnerability into strength. Higher education institutions should consider using death cafes in their teaching and training of student nurses, especially when it's to do with death and dying. And a decision is needed as to which year of training is most appropriate to introduce death cafes. I mean, for us, we did it with the third year student nurses, but I don't think that it would have made any harm doing it in the first year or in the second year. So it's really about the different institutions and what they would like to actually do. So and we would be quite happy to run it in the first year and run it again in the second year and run it again in the third year. And it just gives more and more to the students. I think they would benefit from that. Okay, so I'm also really pleased to announce that this study has now been published only last month, September issue of the International Journal of Palliative Nursing. And if you want to read the full article, then that's the journal where it's been published. And I think it's an overall way of teaching or discussing death and dying with students, and we would like to see it being used, among many more institutions, universities, and colleges. And I think I've probably talked long enough. I will stop here and open up for any questions.
Brian, can I just come in here?
Mm.
Just to say, I think the other thing was this sense of confidentiality, that they knew that I wasn't going to pass on anything that they said to you guys. And I think that was something that that's what really sort of created that that sort of the sense of safety and that sort of sense of openness, that they knew they were really safe there.
Yes, yeah. And that because you were not known to them, and I think that was really important for them to know. It gave them more assurances to speak out, without any hesitation or restrictions at all.
Yeah.
Kelly, I don't know whether you want to moderate the questions, or we can do if you want.
I've got everyone set to. I've got everyone set to so they can't interrupt the talk. I don't know how long it would take me to change everyone, but if everyone wants to put their comments or questions in the chat box. If you can't see the chat box, bottom right there's a little purple little banner icon with a little arrow. If you click on that, The first little icon is a speech bubble, and that is the chat box if you'd like to put any questions in there. I can see a few people have had their hands raised, so yeah, any questions in the chat box would be great.
I think while we're waiting for people to put into the chat, Brian, I think the one thing that I was really touched by was how willing they were to share their experiences with each other, and they actually said that they hadn't really spoken to each other on a personal level. And I remember two of them. One of them said, the one thing that I find really difficult about working with the dying is the smell in the room. And this other person turned around and said, gosh, I feel that too. And there was this sort of sense of support, and then they talked about it, and it's sort of, there was sort of this sense of real sort of support and camaraderie and sharing something that was really hard for them. So, and by the end of the session, they sort of felt like they cleared it, and it was much more comfortable for them to the thought of going back to work in those kind of environments. So I thought that was, I was really touched by that.
Yeah.
That honesty.
Yeah, right. I'm just scrolling through the chat to see if there are any questions. So, you know, this about the channel, YouTube channel.
And there's a question right at the bottom.
Is there one around the bottom? Yeah.
One from Natasha and one from Chris, I think.
Right. So Natasha W says, what was the average age of person attending death cafes, and did the student attend one cafe? Thank you very much. It's very interesting. Right. Yeah. So each student attended one death cafe, and all death cafes were facilitated by one person, Sue. Now, in terms of the average age, ooh, that's really, really difficult to. But I should probably say that the students range from, 19 to 30, probably 40 something. So it's quite a wide range to say. I wouldn't be able to really be honest and give you an average age, but I know we have young, students coming in and quite mature ones coming in as well.
Can I
don't know, Sue, when you met them, your impression?
Yeah, I mean that's a fair age range actually. I would say most were in their 20s and 30s. I would say most, although there were certainly some younger than that. And some people, one was definitely going through a personal experience with one of their grandparents dying and was able to bring that into the group. And I think that helped this person talk about what this person was going through personally. But I'm very interested in what Chris says about the sample size. How I run a death cafe is I if it's just me on my own, I run a maximum group of 10, because I feel with just me as the facilitator, if you have a bigger group than that, sometimes people can get lost. So that's what I did. If we did a bigger group, then I would have more facilitators and then divide the group into groups of sort of five or six group each if it was bigger than 10. So, and I think that's important to feel that a small group is intimate and people feel much more comfortable in a small group than a much larger group. So even if you went to a death cafe, let's say a big one in a cafe, all the death cafes are split into different tables with a facilitator on each table. But I don't think that would have worked at the university, because I just think the room that we were having the death cafe in wouldn't really have been conducive to fitting to dividing a bigger group into two other groups with two facilitators. And I prefer not to do that anyway as a facilitator. I prefer to do one group at a time.
Just to add on to that, because Chris Rose's question I think is really good, pertinent, the sample size of 5, yes, it's very small, but what you have to remember though, in research terms, because this was a qualitative study, yeah, it's looking at individual experiences rather than in the quantity or the volume of students. So it's actually acceptable to have a small sample because it's qualitative study. There are some studies you find they just focused on one, what they call a case study. So that is actually acceptable. Yes, the point about maybe making a bigger study next time, like I said at the beginning, there were 3 interviewers, and we were hoping to interview 5 each, so that we could have more. But the fact that in the end, we actually didn't realize our students were going into clinical placements after coming into university. So the timing was really bad for us. We didn't realize that, and so when they had gone to placements, not many, were available to come and attend the interviews. You see, so that's why we ended up with 5. But I think on a research guidelines and principles, it's not a problem actually to have a small sample. That's what qualitative studies do because they're looking at individual experiences, which is what we explored.
And there's a lot of learning went on, hasn't it, Brian, from this
Yeah.
lot? A lot. And there must have been 60, was 10 in each? No, 30, at least 30, 35 came to the death cafes in numbers, I'd say. It was 3 death cafes back to back, wasn't it? And it was at least 10 to 12 people in each, in each cafe. So
yeah, we calculated it to be about 50 who attended.
Yeah, then it must have been 4. Yeah.
Yeah, we got the names, so it's about 50 who attended, and it was really good. So yes, again, Chris, we want to do another study, funds permitting. We want to do another study where we'll probably go to more than one university and look at what happens maybe in Bristol, Coventry. We might even go to Birmingham and actually find out, whether the model we use also works for students over there. So yeah, that's our next plan now. We're planning, to do that. Okay, let me see if there's any more. Yeah, I think that's about. Somebody put a hand up, but I can't remember. They've put it down now.
There's another one. Thanks so much. As a working, it's very useful. So I'll be looking more into it. Unfortunately, I have to leave. Oh, that's Sam saying he has to leave, but he's going to be looking at as a social prescriber. Okay. Very interesting as a counselling student. I have a lot of counselling and counsellors and therapists coming to death cafes because obviously that's death and dying and grief is what walks into the therapy room, the counselling room. So it's certainly, I don't think there's ever been a study, funnily enough, with counselling students, but how it's helped them to hold the space for their clients talking about death and dying. But I just think, a death cafe, coming to a death cafe in any context, if you're working with people who are, you're going to be exposed to people who are grieving or are dying, then I just think they're incredibly valuable learning process about what's okay for you and what isn't.
Chris,
yeah.
Of non-Western students in nations with different. Aha.
Yeah, this is they are all over the world, but very, very popular in South American countries, funnily enough. But if you go to, I'm going to just put something down here. I'll just put the deathcafe.com. That's the website from deathcafe.com. But you'll see they are all over the world. And of course, the Day of the Dead is next week in Mexico. So, and the Mexicans don't have the same issues about talking about end of life and death and dying as we do. So, so they're much more open to it. But then I think certainly the Death Cafe movement in the UK, I think it's really helped us all to be much more open and honest about talking about end of life and death and dying. I think it's done a huge amount for us.
Yeah, I think for me, I'll be interested to test it out, you know, globally. But obviously, we just have to watch what's happening with the pandemic and so on before we can do that. And I think our position as well, being, you know, out of Europe through Brexit, it's proving quite difficult to have these you know, partnerships to do research with other countries now. So we'll have to rethink and wait and see what other opportunities come from that. But I think it would be really interesting to find out what other students in other countries, you know, think about. And like Sue says, you know, they actually have different perceptions about death and dying. So
that's the thing. Yeah, they're much more open than we are here.
Natasha has come back with a question here. Did many of the participants have an illness, or were the attendees a random group of well living with an illness? What were the age ranges of that? Right. I think we talked about the age one. No, we didn't actually ask people about their illnesses and all that, health status. They were students at the university. That's the only criteria we used, and they didn't need to be random because the study is not a randomized trial. So it was volunteering that we looked at. Would you like to take part? So it was on that basis rather than random allocation. And yeah, so in terms of participants having an illness or not, for us that was irrelevant, and we didn't even ask that. We just wanted them to attend the Death Cafe session and then to participate in our study.
Yeah, having said that, one attendee did say that they had a serious health issue. So that was, and this attendee did talk about that within the context of the Death Cafe, and how it had changed their relationship with their mortality. And that raised a very interesting conversation about mortality and what it means to us, and health and welfare, and when somebody is living with potentially life-threatening illness. So the thing about a Death Cafe is, you know, as I said, you take off the label, you take off the mask, and you come as yourself. And so you never know what is going to come up in a Death Cafe. And it doesn't matter if you're nurses or counsellors or just a member of the public. It is just you're there to talk about what really matters to you. And it's amazing how people will appear as complete strangers and leave as just completely heart-opening experiences and communicating on such a profound level. It always really lifts my spirits that we can meet each other at such a profound level. I'll just say something else that which often happens, and it did happen in the cafe, that a lot of people who come to the Death Cafes often say that they're scared, they're really frightened of dying. And so that's an opportunity again to explore what that means to them. So Chris has just said something.
I was healthy when I attended.
Yeah.
I strongly recommend that everyone study this online.
Yeah. I've never found a Death Cafe morbid. It's, for me, they're full of life. They're really, really full of life. So, because we're talking about life, we're also talking about obviously death, but we're talking about our relationship with life against the backdrop that actually, yes, we are all going to die one day. But I've never ever experienced anything morbid or weird or frightening or anything like that. It's always been just fascinating, actually, listening to people's experiences of how they perceive life and death.
Mm. Yeah.
Yes, this session is being recorded, isn't it, Brian? Yeah.
Yes, I see that. I think Kelly is recording it. Yeah.
Mm.
Yeah.
Has anybody
Right.
got any more questions that they'd like to ask? Yes. Oh, okay, cool. Is there anything else that you want to say, Brian, about what else you found about the death cafes? Or your vision sounds fantastic, what you're saying about maybe going a little bit more global with what you're doing. Do you want to say more about that?
Yeah. I think I think the idea, which is when we do qualitative studies, is to start small and then build on from that. So we started with our university. So now the plan is, can we involve other universities and introduce the concept? And of course, yeah, when times permit, it would be good to go beyond our borders and actually
Mm,
look at that as well. And I'll be quite interested to do Europe and then to do um, developing countries as well, and see what actually happens and what they think about
mm,
it. Um, and I know when you look at the Eastern Bloc countries, yeah, that concept might be very different from how we perceive it here. So again, it might be worth just you know looking and testing the waters there, see if we can do that. What
mm,
obviously we're looking to do is to see if we can get any funding, because that will pave the way for a lot of possibilities if we can get some
mm,
funding,
mm.
and it will be quite good. And yes, we'd
Yeah.
like to interview more students, after attending Death Cafes, and it might be we've learned a lot from this study in terms of timing and when to invite students back to take part. So we've got quite a
Mm,
bit of that going on, and I think the team we use this time, I quite like to keep that team so that because we already know what is expected and what we're doing, and everybody knows their jobs. So that'll be another one to
mm,
hopefully keep. Yeah.
mm. I might just say something about facilitation. Traditionally, the Death Cafe, you don't have to be a counsellor, you don't have to be a trained, I don't know, whatever, or academic or anything to hold a Death Cafe. The most important thing is that you're absolutely okay yourself about your relationship with end of life and death and dying and mortality. I think that's the most important thing. And also having an ability to hold a space for people to have their very personal experiences, and sometimes
Yeah.
it is very raw actually. So it is about being okay with that.
Mm.
But if anybody's interested in becoming a facilitator, really, if you go onto the deathcafe.com website, they've got a sort of page explaining this, what to do and how to do it. But I would say that if you did want to do that, that's fine, but you really do need to get some death cafes under your belt and to work with an experienced facilitator for quite a few sessions before you decide to do them yourself. That's what I would say. And it isn't for the faint-hearted.
Yeah.
But and there's a way of, there is a way of doing it. But anybody can become a facilitator, but not everybody can do it. I'll put it that way.
No, that's really really useful. So I see no more questions. So I think what I will say in closing is that the study is now published, like I said, in the September issue of the International Journal for Palliative Nursing. So if you want to read in more detail, obviously, because the presentation only summarized it. So if you want to read more detail about the study, it is published now, International Journal of Palliative Nursing, September 2021 issue. Um, so again, thank you very much for your time and your contributions. And I'd like to thank my colleague and the co-researcher here, Sue, for being part, and Kelly for giving us the platform to share our findings. And I'll hand over back to you, Kelly.
Oh, great. Thank you very much. Big thank you, to you, Brian, and you, Sue. It's been very informative. I think a lot of people have said they've got a lot out of it, and I think even more when the recording goes live as well. I think a few people had a few technical issues, but yeah, thank you very much. If anyone has got any questions or they want to find out more about our new lectures whenever they are all organised, I'll put my email in the chat box for anyone who wants to contact me for anything else. You'll also get an email soon, anyone who's attended, get an email with some feedback. If you can leave that feedback form, that would be fantastic. It'll all be emailed out to you automatically. If you want to be added to the waiting list, like the mailing list for any future lectures, pop your email in there and you'll be notified as soon as we organise another one. So you can also keep up to date on the Halzone College website as well. But yeah, thank you very much, everyone. Thank you guys for presenting. It's been really interesting. Yeah, and if you're not sure how to leave, the little lines in the top left, if you click on that and you can leave from there. But thanks again, everybody.
Bye.
Bye, thank you very much.
Bye.
Thank you, Sue. Yeah, we'll.
Oh, thank you, Brian. Thank you, Kelly.
Thank you very much. Have great days, everyone.
Yeah,
Lovely.
take care.
Thanks very much.
And we'll be in touch, Brian. Okay,
Yes.
bye.
Yes, that'll be good. Bye.